So next on the programme we're talking to lovely Barbara from Sea Change. You're very welcome to the show, Barbara.
Thank you.
So you might start by telling us Sea Change, why the name?
Well, it's a great question, and it's literally what it says. We want to see change, so it's SEE. We want to see it, and it's about changing attitudes to do with mental health and understanding more about mental illness and getting those voices of lived experience, because everybody has mental health. So it's about helping everybody understand that we're all part of this movement to see change around mental health attitudes.
Do you have any statistics on mental health problems in Ireland?
I certainly do, but I will be honest that I wasn't prepared with a list of them.
That's
so
okay, just off your head.
Well, the kind of numbers that I would say is that, we hear this number 1 in 4 people that we know will experience a mental health difficulty. We actually challenge that and say the 1 in 4 is usually a diagnosed issue. So how many people do you know who go to the doctor or who don't go to the doctor for a sniffle or for a lump or a bump or whatever? They're not going to go for their mental health. So that number is wrong. But most importantly, we all have mental health all the time, the same way we have physical health all the time.
Yes.
So in that way, we like to say actually the number 1 in 4, it's 4 in 4, all of us have mental health. The other thing that we know is from research we've done in the last couple of years that 77% of people who are working at the moment are fearful of having conversations in their workplaces about their own mental health for fear of being treated differently.
That's sad, isn't it?
That's terrible. And the thing is that we see a lot more people are aware of mental health issues now. The language is changing. There's so much happening, but it's safe when it's out there. When it's somebody else that we're talking about, when it's a general conversation, but when it's me and my mental health, don't know that I want to bring that to my workplace. And that's the attitude that we're seeing. So it's why we want to keep doing this work and make it safer for people to be themselves and not feel fearful of sharing that they're going through a hard time.
So the stigma hasn't entirely disappeared, that people still feel they can't be fully open about it.
Exactly. So what we've seen is a shift in what the stigma is. So previously when we were talking about mental health, people automatically jumped to medication, to severe and complex mental illnesses, to hospitalisation and to difficult conversations and things that they were fearful of. Whereas now when we talk about mental health, people firstly understand things around depression and anxiety and stress and those things, but we're also talking about balance and well-being. So people are understanding this continuum that happens. But we're still a bit more fearful around mental illness. And when we talk about that, we're talking about things like, let's say, complex eating disorders, schizophrenia, bipolar disorder, borderline personality disorder. There's a whole range of them. But when we don't know, that's when the fear creeps in and we tell ourselves stories.
And what's the aims of the organisation?
Well, so Sea Change is a programme of Shine, and Shine supports people affected by mental ill health. And from a Sea Change perspective, obviously, firstly, our main goal is to break the stigma associated with mental health difficulties. But for us, it's about making equality around experiences in work, experiences in life, and it's about really giving the voice of lived experience a platform to be able to share their experiences and make society better and normalise conversations around mental health.
And how are you staffed?
So we have 3 staff currently on the Sea Change team and across Shine.
Full-time staff?
Full-time staff, at the moment. So we run a workplace programme, we run an ambassador programme where we train people to appropriately tell their own stories. And then we have the Green Ribbon campaign as well, where we distribute 500,000 ribbons, around the country every year. So we do lots of different things. We also do research. So some of the statistics I mentioned are national research that we do. And then across Shine, there's probably about 38 of us. So we run the headline programme as well, which looks at media monitoring and education for journalists about responsible reporting. And we also have a lot of frontline staff who work one-to-one with individuals experiencing mental health difficulties and their families and supporters. So there's loads of information on those 3 websites. That's shine.ie, headline.ie and seachange.ie.
And I suppose you do work with the schools, would you?
We don't actually.
No,
we don't. So our remit would be 18 and over. We would flag and signpost to organisations that deal with youth. So for example, for mental health, we would go to Jigsaw, or you've also got Spun Out, which looks at people up to the age of 25 with all sorts of different youth issues.
Because mental health in young people is a gets a lot of coverage these days.
It does. And it's really important that we have conversations about mental health earlier, most certainly. But I suppose for the work that we do, we're funded to work with over 18s at this time.
Okay.
Yeah.
And what is stigma reduction?
It's a great question. So when we talk about stigma, sometimes we make assumptions about people knowing what that is. So when we say stigma, what we mean is stereotyping, prejudice and discrimination. Right. So stereotyping is when we think of somebody and we put an image of what they look like. So if I say to you, a lawyer, you might automatically have an image of a man in a suit in a fancy room with a big desk and loads of files in front of him. I never said it was a man. I never said how he was dressed or what room he was in. So stereotyping is that unconscious bias that we jump to. The prejudice is then what creeps in when we make a decision based on our thoughts rather than actual fact. So for example, when we're talking about mental illnesses, if I said to you that I was diagnosed with schizophrenia, you may assume that I have uncontrollable issues that I can't deal with, or that I'm not capable of working, or maybe even that I'm dangerous. And some of those are the myths that go along with mental illness stigma. And so when we talk about prejudice, we're trying to help people understand, get the information, ask the person, because maybe their experience is very different. And the discrimination piece is really interesting, because mostly when we think about discrimination, most people say, oh, I wouldn't do that, I wouldn't treat somebody that way. But actually what we see now is it's much smaller, so it's more micro discrimination. And actually we see it in that, like let's say if I was working with you and I went out of work and it was because of a mental health issue. If I had gone out of work because I broke my leg, you'd probably send me a text and say, I'm thinking of you, hope your leg heals up. What did you do? Yeah. This kind of thing. Yeah. Whereas if I go out with a mental health issue, we're less likely to have that conversation. But it's usually because we're fearful of saying the wrong thing.
Yes.
We're afraid we're going to upset the person. We don't want to step in it. We don't, and it's a very normal thing. But what's happening there is stigma. So stigma, we say, is silence. And it's the impact of that, because now we're not having that conversation, but we're not talking about the weather. We're not talking about cooking. We're not talking about work. We're not talking about anything. And that's the piece, because quite often conversations about mental health aren't actually about mental health. They're about life. And we talk about how we manage our difficulties, and that helps our mental health. But if we're not having the regular conversations in the first instance, we're not going to talk about what we're struggling with.
Of course. You mentioned Green Ribbon. What's that all about? So
we started Green Ribbon 11 years ago now, and it's about wearing, so I have a pin on here, and we celebrate the Green Ribbon each year to try and get more conversations about mental health. So people associate the idea of mental health conversations with the Green Ribbon. And so we provide, like I said, 500,000 ribbons every year, free of charge, nationally, so that people can get them and wear them, so that if somebody sees they're wearing it, they know they're open to have a conversation about mental health. It's not saying that you have to be a counsellor or be able to give guidance, but to be able to say, I know you're not feeling great. Yeah. Do you want to tell me what's going on?
Yeah, to put your hand up.
Or that, to be able to say, I'm not feeling great. It's one of the things I talk to a lot of people about when in Ireland we say, how are you doing? Oh, I'm fine. And I say to people, but how are you really? Because that piece about being fine, it isn't enough. And sometimes we brush off how we feel, so we don't even know ourselves. So Green Ribbon is really an opportunity to step out of that and ask a second time, and even ask ourselves, actually, do I need to check in with somebody, or do I need to lift the phone? And equally, if I need to do it, maybe there's somebody I need to check in on because they haven't been showing up the same way, or I've been missing them a little bit. And
right.
It's that piece. So we do events all over the country, and we support other people to engage in events as well. So the kind of things that we do, for example, is we partner with the IFAs, that's Irish Farmers Association, and Coilche, and Mental Health Ireland, and we do talks all over the country, and we walk in the parks. And it's that shoulder by shoulder piece and being out in nature. So there's going to be 16 walks going out across the month of September. We also have in-person events. The launches are on the 1st of September in Dublin and the 5th of September in Cork. And then we're going to have weekly events online. And then in addition to that, other people will be doing things all over the country that we will support them, whether it's providing ribbons, providing mental health speakers. So there's lots of different things that people can do, whether it's community or workplace.
I saw the tea bag mentioned.
Yes, absolutely. So we have been kindly sponsored by Boots this year to provide tea packs. And what it is literally 2 tea bags in an envelope. So it has some signposting on the front. The whole purpose is to take the envelope and make 2 cups of tea. So it's for you and a pal or somebody that you think, I need to have a chat with this person. Yeah. And hopefully in the middle of your chat, the 2 of you will check in and see how you're doing. And that's a normal conversation. And that's how we break down the stigma around mental health. We make it normal.
And do you have famous public figures joining in the campaign? Are there a number of?
Not so much, no.
Right.
So we're kind of more from a point of view of the community-based spirit at the moment. Yes. So obviously for anybody listening, if they know anybody that is a big name or big celebrity, we would be delighted to have them on board. But from a point of view of really making this a very general conversation, we're showing up in communities across Ireland.
Because in recent times, some public figures have come forward and, you know.
Oh, absolutely. And we do. So we would have a lot of people in the Oireachtas and TDs come with us, for example. And people like Brent Pope, for example, is a big supporter of our campaign, and we would work with people like that. Yeah. Because the thing is that, like I said, everybody has mental health and it's a more regular conversation now. So, but I think for us, we haven't been targeting particular celebrities this year per se.
Right.
You have a lot of information on your website for workers, managers and staff.
We do. So we run a stigma reduction programme for the workplace, and as part of that we have a lot of information, as you say, up there, and it's freely available and it's free to download. Some of it is in our Mental Health Matters guide, which is research that we did on stigma in the workplace in the last 2 years. But it has tips on how to start conversations and the things to be aware of. It also talks about things like mental health and how it fits in the law and employment law. So we also have a couple of guides around mental health law and how to get around that. For anybody who is interested in running that programme, it is funded by the National Office of Suicide Prevention, so there's no cost involved. And all of our guides and all of our documentation is free of charge in relation to that. And we do things like mental health policy and procedural documents as well. So we release all of those to those workplaces who sign up.
And the 6-stage workplace pledge, which is a bit of a tongue twister.
It certainly is, yeah. So basically what we saw when we started this programme back in 2013 was that organisations were ticking the box. So they had now done mental health. And so we started looking at what can we do. But what we also saw was organisations had done this workshop and then said, actually, we need to do more. What does that look like? So then we started looking at this framework. So we now have an action plan where organisations do 6 steps that make sure that they're embedding the mental health culture and they're putting all of the policies and procedures in place. So one is to train line management appropriately. The second in mental health. Oh yes, exactly. In mental health issues, looking at stigma reduction. We then require a mental health policy not only to be written but also implemented. So that means the procedural side of it has to be there. We look at staff training as well. So if your leaders are doing it, what are they doing with the rest of their teams? We look at staff champions, and quite often a lot of people would do the like of mental health first aid, which is how to recognise and appropriately respond to somebody in a crisis until appropriate help arrives. Okay. So a lot of people would do that, and the champions sometimes might be the ones to bring the green ribbon into their organisation or organise talks and those kind of things. And then we do external engagement, so it's about how a company externally shows people we're living good mental health in our organisation. And then we go through all of it and we do a survey and reporting, and then we certify them at the end. And this year I'm delighted to say we have an in-person event for our workplaces in November. So
that's brilliant.
Yeah, so it's really exciting times.
That's a very thorough piece of work.
It is, and the thing is that there's huge documentation for each step. So even in the green ribbon, we would have a section with documents around how a workplace can engage in that. In the relation to the mental health champions, we have documents around what does that look like, what does it involve, and what's the ask both of the organisation and of the champion as well. So there's a huge amount of supports there for organisations if they're going to get involved in something like that.
How was COVID for you all?
Very interesting. I think when it started, we all thought, this is great. We're going to have a bit of a quiet time. But of course, obviously, everybody was impacted. So mental health conversations grew. What I do think is that COVID gave people the opportunity to be more real. Yeah. So first of all, we saw managers and CEOs, sitting at their kitchen table, maybe not in their pajamas, but certainly not in suits anymore. Yeah. We saw their kids, we saw their animals, we started realising people's pressures and those kind of things. But what we also saw was people saying, I feel really isolated, I feel alone, or I'm really worried about this. So we started talking about normal stresses of life.
Right.
So, and I think that piece around loneliness opened the door to have a conversation saying, I'm not feeling right and I don't know what that's about. So before, we wouldn't have done that. And that's a very normal conversation about mental health. So I think the pandemic has shifted attitudes, that we now understand more about mental health and the impact of stress and the impact of, being isolated and those things. So people are doing more from a well-being perspective. Yeah. But we definitely need to do more on understanding around mental illness, for sure.
People realise too that working at home wasn't a cakewalk, it brought its own stresses and strains.
That's it. And for some people, the physical engagement and the being in a room with other people is really, really important. And we've also seen for some people who struggle with anxiety that coming back into those spaces can be really challenging at this time. And I think the thing for everybody to understand is we're all different. So we're at different stages in finding out what this new reality is as we're stepping back into a more open society.
How do people get in touch?
So a couple of different ways. So I have my piece of paper to remind me. So if you are on social media, we are on Instagram, TikTok, Facebook, Twitter and LinkedIn, and we are C-Change IRL, and that's the National Stigma Reduction Programme. You can also visit our website at cchange.ie, and we also have a podcast that was hosted by one of our ambassadors, and she spoke to lots of people experiencing mental health difficulties, people in service provision, and just lots of different conversations around mental health, around issues that come up for people and around things that help. And they're available on Spotify and Anchor FM, and you can find them on our website as well. I'd lastly like to signpost as well to supports. If people are listening and either they need some support themselves, or they're listening and they say, you know what, my friend is not in a great place, or my child is not in a great place, there's a number of really good supports out there. What I would say is that for people who are engaging in the services, and I know there's a lot of conversations around lack of service, don't wait until you have an appointment. There are things you can do in the meantime.
Right.
So some of the places that I would signpost to, obviously my own organisation, shine.ie, so they do recovery-based work one-to-one, and they work with families as well. Yourmentalhealth.ie is a really, really good website run by the HSE, and they do county-by-county information on where to get supports, but they also run lots of training programs, and they do things like stress resilience and management and all those kind of things. So really amazing resources there. Obviously for depression particularly and bipolar disorder, Aware is really good and runs some really good workshops. And Pieta House for anybody in crisis as well, so that's suicidal ideation and that kind of thing. So in really difficult distress, Pieta House is really important. The text line 50808 is 24/7 as well, and also we always flag to the Samaritans, and that's 116123. And we'd also flag to Suicide or Survive, because they run wellness workshops as well. So for somebody who's looking to maintain their well-being or learn a little bit more about what to do, I think that would be really helpful. The things lastly that I would signpost to, if you aren't managing your mental health well and you're waiting on that appointment I mentioned about doing things, the kind of things I'm talking about are really simple. It's things like making sure you get outside and get some fresh air every day, move your body, make sure that you connect with a human being at some point during the day, do things like that. And also eating and sleeping are really important, because they go out the door. And it's one of the things, when I was very unwell and people told me those things, I was kind of going, oh, well, that's great. Like if I could just do that.
Yeah.
But actually when I got better, I realised that when I was really low, and I'd stay up watching TV until 2 o'clock in the morning, then of course I'm going to get up later, I'm going to be more tired. And when we're tired, we eat more sugar and we eat all the bad things. And so I was doing things to my body that weren't helping and were impacting my mood. So I had to go through that fake it till you make it and eat the healthy food even though I didn't want to, and go into bed on a particular time to fix my cycle. And the impact it had on my mood was phenomenal.
Just sleep at the right time.
Sleep and water. I'm a devil for not drinking enough water. So the things that make your body work actually have a huge impact on your mental health. So it's those things to start with. And the thing is, if you're struggling to do some of those things, buddy up. Do it with somebody so that you're not alone. And if it's a thing that you're living on your own, there's lots of groups that you can join. So even if it's doing it through social media or doing it through an online group, there are ways of doing it. So it's about being a detective about what can work for you.
And you spoke about the podcast.
Yes.
And particularly I'm trying to focus on the partnership with our gang,
Yeah.
the Blanchardstown Centre for Independent Living.
Yeah.
What's it all about?
Well, I think it's important for people to partner in different ways, for people locally to hear about what you guys are doing, and then to hear about actually there is something going on around mental health that we need to have an understanding of. And I think that's how we normalise these conversations, that we show up where people are. So I think from a partnership perspective for us, it's about seeing that we're on the same key messaging about empowering people, supporting people to live better lives. And for us, it's reducing that stigma while we're doing it. And I'm certainly very interested in seeing how people sharing their own stories is going to help other people who are listening.
And that looks like it's going to be the content.
Yeah.
Okay.
Yeah.
And the agreement we put out there is that we'll air it once a month.
Yeah.
Yeah.
You renew them every so often?
Yeah.
Right, very good. Lastly, as we come to the end of the interview, is there anything else you want to put out there?
Well, I think we've gone to the signposting and we've done the tips. What I would say is that piece about don't wait. It's the biggest thing and the smallest thing at the same time. And I think for anybody struggling, if they've never had a conversation about mental health before, or they've never asked somebody for help, or they've never told somebody that they're not managing, it seems like a mountain to climb. Or if we're the person witnessing that person and we're afraid to ask, or we're afraid to say, I've noticed you're not quite yourself. Is there anything going on? Is there anything I can support you with? I'm here if you want to have a chat. I think those are the conversations that we need to be really brave about. So for anybody who is needing support, maybe having a look at yourmentalhealth.ie or texting 50808 or even ringing the Samaritans just to see what it's like.
Yeah.
And I think it's that thing that sometimes we get so into our own minds about what it is we're going to get from it that we nearly talk ourselves out of it. So if we can take the pressure off ourselves and the other person and say, I'm just going to try it and see, and take it from there, because living in that space of struggle and fear is very lonely, and it adds to the difficulty that we're experiencing with the illness as well. So take that pressure off yourself, allow yourself, pick up the phone or even have a check online and see. And sometimes that first step, it makes it easier then to say, well, okay, I'm going to do the next step now. And then maybe look at those things around, getting outside and eating and how you can make your physical body better in the meantime. And just see, does it make even the tiniest change? I think those things, they seem trivial. And certainly for me, I never thought they would help. I never thought I would get better. And here I am now, 14 years later,
Brilliant.
Not on medication, running a national programme, driving a nice car, doing all the things I never thought I could. And it's because I constantly did all of those tiny, tiny steps that I thought were irrelevant. And in the beginning, I pretended because I didn't want to do them.
Yeah.
So it's to fake it till you make it. So I'd say for all the stuff you're doing, get a mantra and stick with it. So for me, it was either baby steps or fake it till you make it.
Yeah.
So pick something that makes sense to you and use that to push you when you really don't want to get up, when you really aren't bothered to eat, when you really aren't bothered to put the water on and have a shower or lift the phone or whatever. Fake it till you make it. Pretend you want to do it until you've done it and see, does it make a difference.
I think all of that is particularly poignant for people with disabilities
Absolutely.
who see themselves as a mental health issue.
Yeah.
And now, with all the information that you've put out there and all the reference points, they get some help.
Absolutely.
I'm very grateful for you coming in.
Well, thank you.
Thank you so much.
I think
Thank you
the
very
thing
much.
about disability is that I've seen a number of people who have physical disabilities, for example, and they feel like because that's their disability, they're not allowed to have mental health issues as well.
Yeah.
And the same with when we see people with addiction or any kind of issue, it's like, oh, well, that's the box I'm supposed to fit in.
Yeah,
Mental health
absolutely.
isn't tidy. It isn't. It's messy. And that's the thing, that if there's anything going on in our lives, whether it's exams, whether it's work, whether it's a disability, if it's making you feel a certain way that's negative, that's affecting your mental health. And it doesn't matter how big or small the issue is to somebody else. If it's affecting you, it's big enough to go and ask for help.
Absolutely. Barbara, thanks a million for coming on
Thank
the
you
show.
very much.
My pleasure.